Hi, this is Chadi Alraies. This is CVI 2019 Denver, Colorado. With me is Dr. Joao Cavalcante. He is the director of structural CT as well as cardiac MRI at Minneapolis Heart Institute. Welcome, Joao.
Thank you, Chadi. Nice seeing you.
Great session at the tricuspid valve. Can you fill us in about what's new upcoming of the role of CT and MRI in tricuspid disease?
Yeah, so tricuspid as a field is really now getting into the attention. We're learning much more about where do these patients fall. What we highlighted in this session is that we cannot rely only on the echocardiography quantification of tricuspid regurgitation. Absolutely. I think in a lot of that, why these patients have been called a forgotten valve is because we tend to underestimate consistently. So what we call moderate actually might be severe, what we call severe might be actually more. And so these patients fall under the radar screen, and their symptoms when they develop are very non-specific. It's fatigue, it's like they feel unplugged, they don't feel like they eat a little bit. So they're very non-specific. Lots of things can cause that. What I highlighted there is that there is actually a natural history. By the time moderate tricuspid regurgitation takes place, there are already anatomical changes that occur seen by CT in the right atrium. The right atrium is actually the canary in the cold mine. It's the first chamber that dilates to receive that volume, followed by the circularization or dilation of the tricuspid annulus. Dilation of the tricuspid annulus becomes circular, and then that begets more TR, that begets more atrial fibrillation, that begets left atrial dilation. By the time it reaches the right ventricle, by the time the right ventricle is dilated in dysfunctional, Ben, this is end game. I think it's too late. And some of these ventricles might still be recoverable, but I think we are seeing that end of the road. We need to bring this upstream. And that's, I think, what we highlighted.
How about the pacemaker wires, and does it interfere with the CT resolution and so forth?
No, it does not so much. Actually, we were showing too that CT, it's a beautiful modality now, especially with a dual source, which it has a high frame rate, has a high temporal resolution. We're able to see the leaflet motion quite well. The pacemaker wires do not interfere, and even the mitral clip, after we have put into the tricuspid valve, does not cause so much interference. So I think CT can be a very good tool, not only to assess the pre-planning procedure, but also following the therapy, just the remodeling. Prognosis. Yeah.
That's very delightful, and new technology, new things for the tricuspid. That's open for sure to open the space for the tricuspid valve intervention as well. Thanks, Joao, for your time. Always insightful to talk to you.
Thank you, Chadi.
Watch these videos and others on CVI YouTube channel. This is Chadi Alraies from Denver, Colorado.